Welcome to this Better Breathers Club webinar on decreasing the risk of exacerbations with lung disease. In part one, we discussed the importance of staying active when living with lung disease. In part two, we will be discussing ways to improve your healthcare journey by exploring correct medication device use, airway clearing techniques, and having a team approach to your disease. For more than 115 years, the American Lung Association has been a champion for lung health with a mission to save lives by improving lung health and preventing lung disease. We accomplish this goal through research, advocacy, and educational programs such as this webinar. I'm excited to introduce our guest speaker for today's webinar, Jennifer Macbeth. Jennifer received her BS at St. Catherine University in 2010. She has been employed at the University of Minnesota Medical Center with cardiopulmonary services since 2008, gaining experience in adult critical care and respiratory therapy management. In 2016, she accepted a new position to help co-create a COPD readmission reduction program to tackle excessive COPD hospital admissions and to improve the quality of care this patient population needs. Jennifer became a certified tobacco treatment specialist through the Mayo Clinic program. Smoking is a primary cause of COPD, and she provides counseling and relapse prevention for her actively smoking patients. In part one, we will be discussing the correct use of medication delivery devices. Before Jennifer joins us, I wanted to share with you some of the great resources that you can find on the American Lung Association website by visiting lung.org. In the How to Use COPD Medication series that you see on the left in the slide, you can click into whichever device you use when you are on the website, and there is a video demonstration that shows how to correctly use each specific device. A few of the devices are shown here. However, there are more on the page that is linked at the end of this presentation. We also have videos demonstrating how to correctly use your nebulizer and clean your nebulizer, and a series of videos on therapy, ranging from how to get started with home oxygen, how to travel with oxygen, and managing different oxygen delivery systems. Next, I will turn over the presentation to our guest speaker, Jennifer Macbeth. During the presentation, Jen will be demonstrating the correct technique for using various devices. Please remember, these are brief demonstrations, and she encourages you to talk to your healthcare provider to ensure you are doing the techniques that apply to you correctly. Welcome, Jennifer.
Thank you. Thank you, Jen. It's my pleasure to be providing you with a little bit of knowledge and expertise. In addition to operating your medication device correctly, there are two equally essential requirements to using your breathing medication. You may be inhaling your rescue inhaler or your maintenance inhaler incorrectly. If this is the case, you may not be getting the drug particles into your lungs where they will help your breathing the most. I'll explain. You must have enough inspiratory capacity or enough strength or power and the necessary inspiratory flow or speed to inhale to get the medicine deep into your lungs. If you inhale the medicine from your rescue inhaler too fast, most of the medicine may stick to the back of your throat, your mouth, or end up in your stomach. If you refer to the graphic on your slide, you will see that most of the medication is in the participant's upper airway. Using your device correctly on the right, you see with using the spacer, the medication gets deep into your lungs. So if I were to inhale incorrectly while using a spacer, I would get a warning sign on the spacer. It would sound like this. I've inhaled this medicine too fast, and the medicine is in my upper airway now, not getting deep into my lungs where it will help my shortness of breath. So to do this correctly, this is the proper technique. You may have noticed I inhaled over a period of 3 to 4 seconds and heard a little bit of that harmonica sound. That is okay. That ensures that you have gotten the medication that was in the spacer or the holding chamber, and you inhaled it slowly and deeply and got it deep into your lungs.
Jen, can you come in a little closer so we can
Oh.
hear that harmonica sound? So if you could do the inspiration the incorrect way so we can kind of hear that harmonica sound, that would be great.
Absolutely.
Thanks.
This is a common question that sometimes people think that by hearing the harmonica sound, you are inhaling correctly, but that is wrong. If you inhale using the spacer and you hear the harmonica sound, it's telling you, slow down, you are inhaling too fast. Were you able to hear that?
Little hard to hear, but the explanation was super helpful. That's okay. Thank you. Yeah.
All right.
Yeah, great.
Dry powder inhalers, however, require more breathing strength. Without enough power to breathe in, you may not be getting any or enough of the medication deep into your lungs. Remember, in dry powdered inhalers are in fact powder. The molecules weigh more. So if you inhale too slowly, most of the medicine may stick to your tongue. You must breathe in fast and forcefully to get the medicine deep in your lungs. I will demonstrate. Now, was that clear enough in inhaling fast and hard?
It was, yes.
Okay, good, good, excellent. Very good. Next, I will be discussing different devices and techniques that can help you with loosening mucus from your airways to cough them out. Sometimes in COPD, the body can make a great deal of mucus that can cause coughing. It is very important to clear this mucus out of the lungs. Because of this mucus, the airways can sometimes get more easily infected. The airways can also become swollen, red, and sore, making it hard to breathe. A flutter valve or oscillating positive pressure device is a tool to use every day to help control and cough out mucus. This device works by blowing into the device for a series of breaths. The vibrating air can loosen the stuck mucus and is most effective if used every day. Talk to your healthcare provider if you are experiencing excessive mucus. I will demonstrate the device to use. This is an example of an oscillating positive expiratory pressure device that can help you loosen the mucus. You would use it every day, twice a day, a series of breaths in the morning after you wake up, and another series of breaths before you go to bed. Each breath is called a maneuver, and each maneuver looks like this. Take a large, deep breath and blow. Jen, are you able to hear that fluttering sound?
We can hear it, but you demonstrated a really good deep breath and then blowing in. Is there anything that people would see while they're doing it?
So there is a manometer associated with this style of flutter valve. And the manometer, as you can see, has a green, yellow, and red zone. And when you blow out, a red ball will come up into the green zone. What I want viewers to understand is when they're blowing out, that red ball must remain in the green zone. And the exercise and the challenge, which is good, it's a good challenge, is for the red ball to remain in the green zone for as long as possible, at least 3 to 4 seconds. If you can't maintain that at first, keep working at it. You will get stronger and stronger. It is also important to remember to cough every 1 to 2 breaths, as the fluttering of the valve will help loosen the mucus.
Great explanation.
I will turn this way so you can maybe see the manometer.
Looked good. Yep, great.
Excellent. Another tool to use to help clear mucus out of the lungs and to strengthen your diaphragm and to inflate those little air sacs into your lungs is the incentive spirometer. It is a breathing device used to strengthen the lungs after surgery and to encourage patients to take slow, deep breaths. During surgery, a patient's breathing may slow, which could lead to your air sacs not fully inflating. If you have surgery, pneumonia is a major complication, and it keeps the lungs fully, the incentive spirometer keeps the lungs fully inflated and strong by reducing this risk. The incentive spirometer can also be used during pulmonary rehab. Here, you can strengthen your breathing muscles and improve your exercise tolerance. I will demonstrate the correct use of using this device. As you can see here, there is a blue bead inside this chamber and 2 blue arrows. This device requires you to inhale slowly and deeply. To be effective, the blue ball, the blue bead must be in between these 2 blue arrows. I will demonstrate the correct way. Notice how I kept the blue bead in between the 2 arrows. That allowed for full inflation of my air sacs in my lungs. Too many times, patients will inhale too fast, which looks like this. They think that they need to raise this portion of the incentive spirometer as high as they can. That's incorrect. Keep your eye on the blue bead and in between the 2 arrows. The next technique I'm going to demonstrate is something that you can do while sitting. And you can do this after using the aerobica or the incentive spirometer. And the technique I'm going to demonstrate is called a huff cough. A huff cough is a specific technique that you can use to help loosen and move the mucus out of your lungs. Your healthcare provider may have you use this technique after performing another therapy, such as the flutter or the incentive spirometer. Here is what the technique looks like. Sit tall and straight in your chair. Take a large, deep breath. Bend forward and make 3 sounds like you're trying to clear your throat, as in a huff. I realized that I took 2 huffs and then coughed, so I'll do it again. 2 or 3 huffs and then cough forcefully. By huffing, you are helping to mobilize mucus stuck deep in your lungs, moving it up, 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 up. And the final cough is helping to push it out. Another device to help move mucus out of the lungs is a high frequency chest wall oscillation. This is a specific airway clearance therapy that involves putting on a wrap or a vest-like garment that will inflate around your chest. The garment is attached by hoses to a machine that sends air to the garment. The air rapidly inflates and deflates, which can shake loose mucus that may be stuck inside your lungs. A typical treatment can last anywhere from 10 to 30 minutes. The garment looks like this, or can look like this. And this type is something that you would put on, much like a life jacket. You secure the garment with the clips. Then there are hoses that you would attach to the garment right here and right here. And those hoses go to a machine or a compressor that you would turn on. And the garment inflates, much like a gentle balloon around your lung cage or your rib cage. The vest will kind of gently compress your rib cage and then gently oscillate while gently squeezing as you may do your nebulizer therapy. This compression and shaking helps loosen the mucus that's in the clogged airway for you to cough out. The huff cough can be an important part of using the vest in that you can stop during the treatment and perform the huff cough. Because the vest has already mobilized or loosened the mucus, the huff cough can be very useful and beneficial in helping you get it out the rest of the way. Now in part 3, let's talk about supplemental oxygen. If your COPD causes low oxygen levels in your blood, you may need oxygen therapy at rest. When you sleep or exercise, some symptoms of too little oxygen in the body include shortness of breath, lightheadedness, and a fast heartbeat. Because COPD causes lung tissue damage, oxygen sometimes cannot pass from the lungs into the body. All living tissue and cells require oxygen to function properly. If you've been hospitalized, you may have been tested for the need for oxygen and have been given a specific prescription for oxygen. The need for oxygen may be temporary as you recover from your lung flare-up, or it may be permanent. Your healthcare provider will help determine what kind of supplemental oxygen is right for you and how long you may need to use it. The best way to monitor your oxygen levels at home is to use a fingertip pulse oximeter. These can be purchased at your local pharmacy. Based on your needs and following your prescription, you can monitor your body's oxygen levels at various times throughout the day. During physical activity, be sure to increase your oxygen to the prescribed amount if your healthcare provider has recommended it. If you are using supplemental oxygen following a medical event, after a few weeks of recovery, your doctor will most likely perform a walk test to see if you still need oxygen at rest and with physical activity. You may have recovered to a point of not needing oxygen at rest or physical activity, and your healthcare provider will assist in determining this. Many people ask about using their oxygen when they shower. However, even if you do not need oxygen at rest and with physical activity, it is still important to ask your healthcare provider to test you for nighttime oxygen use. Your oxygen levels may drop to unsafe levels during the night as you sleep. For your health and well-being, it is important to find out. A simple test at home can be ordered from your provider to determine if nighttime oxygen is appropriate for you. So back to showering or bathing with oxygen, it is possible to wear your oxygen while showering or bathing. Some important considerations include having long enough tubing to reach the bathroom from your stationary concentrator into the bathroom. Consider investing in a shower chair to make it easier to do what you need to do. You will exert yourself less when sitting rather than standing. Control the humidity in the bathroom as you shower or bathe, since excess humidity can interfere with comfortable breathing. Also, consider getting a terry cloth robe, which you can put on instead of drying yourself with a towel. By putting on the robe, you can dry yourself off instead of using the towel and not exert yourself too much. Maintaining your lung function, including regular visits with your general practitioner, your pulmonologist, or other specialty providers, can prevent further lung function loss and maintain your quality of life. Additionally, there are other ways you can take control of your COPD. People with COPD who maintain an active lifestyle have reduced symptoms of COPD, such as shortness of breath. They have improved exercise tolerance and have higher energy levels. If you are not as active as you would like, you can ask your healthcare provider if an exercise program such as pulmonary rehab is right for you. A medically supervised exercise program can provide exercises tailored to your specific needs. You will start slowly and build from there. With each step, you will get stronger and be encouraged along the way. Of course, everyone has a bad day. But for people with COPD, monitoring your symptoms and checking in with yourself every day is important. Ask your doctor for a COPD action plan. An action plan is a visual reference of signs and symptoms of a lung flare-up. It lists steps for you to take depending on how you feel. The goal is to take action before your bad day turns into something worse, like a hospitalization. Being hospitalized can further lung function loss. You can print this action plan from the Lung Association website and bring it to your next visit for more instruction. Remember, don't let COPD control you. By actively managing your disease, you can maintain your quality of life for as long as possible. Ask your doctor how to optimize your health and try not to worry about asking for help if you need it. Many trained professionals will assist you in all areas of your life. Examples of other providers are a nutritionist who can help you with a healthy COPD eating plan, the counselor who can help you work through feelings of sadness or loss, and the pharmacist to help with inhaler costs. You are not alone, and you shouldn't have to be as you maneuver through your healthcare journey with lung disease. Remember that there are other people that are available for support, both emotional and physical, and experts that can help you live the best possible quality of life by sharing their skills and knowledge with you. Maintaining your lung health is a team effort. Now I will turn it back over to Jen. Thank you so much.
Jen, thank you so much. That was such helpful information. I'm sure everyone found it extremely beneficial. Throughout the presentation, some resources were mentioned that can be found on lung.org. And I have those listed here on this resource slide. So there's several links that people can go to and find out more information, again, that Jen had mentioned throughout this presentation. And remember, you always want to talk to your healthcare provider to find out what is recommended for your specific case. Thank you for joining us today, and we hope that you found this presentation helpful. Jen, thank you for taking time to be with us today.
Thank you.